How does this happen? 4 patients, 4 routine joint replacement surgeries. And according to the hospital, all 4 received the wrong medication.
One 72-year-old woman went in for a knee replacement.
Her family says she is now paralyzed from the chest down. So my question isn't simply, who made the mistake? My question is, how did a mistake this catastrophic make it through the system? Ascension Saint Thomas Midtown has acknowledged that a pharmacy error resulted in patients receiving potassium phosphate instead of bupivacaine, the local anesthetic they were supposed to receive. Think about that for a second. This wasn't one medication error affecting one patient. This affected 4 different patients. That means we need to look beyond one individual and start asking about the system. Because medication safety is supposed to have layers. The correct medication, the correct concentration, the correct label, pharmacy verification, storage and dispensing procedures, administration checks, and safeguards designed specifically to catch human error before that medication ever reaches a patient. So where did those defenses fail? And this is where we need to have a much bigger conversation about healthcare in America. Because healthcare workers are human. Humans make mistakes. That's exactly why hospitals are supposed to build systems that make catastrophic mistakes hard to commit and easy to catch. But what happens when those systems are operating under pressure? When departments are short-staffed? When experienced nurses, pharmacists, and technicians leave? When workloads increase? When people are rushing? When someone is covering multiple responsibilities? When productivity becomes more important than having enough people and enough time to safely do the job? I'm not saying that's what caused this incident. We don't know that yet. But these are exactly the questions investigators should be asking. We need to stop blaming one person and look at the system. Healthcare loves to talk about the Swiss cheese model. One safety barrier can fail, but another one should catch the mistake, and another, and another. A catastrophic event usually requires multiple holes in those defenses to line up. So when the same wrong medication reaches 4 different patients, I don't just want to know who touched the syringe. I want to know, how was it prepared? How was it labeled? Who verified it? What did the packaging look like? Where was it stored? What policies were supposed to prevent this? Were those policies actually being followed? Was staffing appropriate for the workload? Were people interrupted or rushed? Were there previous near misses? And if there were they reported and acted upon? That is patient safety. And nurses, pharmacists, techs, and physicians need to understand something else. When healthcare systems become strained, the individual clinician can become the last safety barrier standing between a system failure and a patient. And when something goes wrong, guess whose name is sitting in the medical record? Yours. That's why I've said this over and over. Slow down. Even when everyone around you is rushing, check the medication. Read the label. Question something that doesn't look right. Document your concerns. Use your chain of command. File the safety report. And don't let anyone make you feel difficult for protecting your patient. Because that's how we always do it isn't going to protect your license when something catastrophic happens. Ascension says it identified the cause of this event and implemented corrective safeguards. State regulators are investigating. And we may learn much more about exactly what happened. But 4 patients should never have had to be harmed for a safety weakness to be discovered. One of those patients walked into a hospital expecting to get her knee fixed. Her family says she woke up unable to feel her body below her chest. That is life-changing. For the patient, for the family, and probably for the healthcare workers involved. So don't look at stories like this and think, that could never happen at my hospital. Look at them and ask, what prevents this from happening at mine? Because patient safety and protecting your license often start in exactly the same place. Speak up. Verify. Document. And when something doesn't make sense, stop. Even when the system is telling you to hurry. This is Cover Your AZRN. Because protecting your patient protects you too. Please like, subscribe, and follow so more people can become aware. Protect your patient, protect yourself.